We need to divide this into primary and secondary epilepsy. Primary epilepsy is the epilepsy without any obvious cause, like a brain tumor or a head injury. The secondary epilepsy is following the head injury or a brain tumor presence or a stroke. So if it is a primary epilepsy, we just need to first do the test called as electroencephalogram, EEG. It is like ECG of the brain.
Okay.
You know how we do ECG by sticking certain electrodes
Hmm.
on the heart area and picking electrical activity. The brain has four types of electrical activity.
Okay.
Yeah, alpha, beta, delta, gamma. So these electrical activities are shown normally when you put those leads and record. In epileptic seizures, you can get spike and wave sort of a feature which
Okay.
clearly diagnoses epilepsy.